Hi, and welcome to Askimo TV. I'm talking today to Dr. Feilim Murphy. Dr. Murphy is the clinical lead for Paediatric Surgery and Urology at St. George's Hospital in London, specializing in undescended testes and incontinence. Hi, Dr. Murphy, how are you?
I'm fine, thank you very much.
Very good. Dr. Murphy, let's talk today about childhood kidney stones. What is a kidney stone and why is it becoming a more common problem that children are suffering?
Well, kidney stones are literally what it says on the tin. They are small stones that are formed within the renal tract. They're usually deposits of minerals that the kidney normally filter that get stuck together in form of small stone. Sometimes it's due to infection, or sometimes the stone forms and then infection occurs afterwards. As regards them becoming more frequent, this is one of those kind of interesting questions. They are becoming more frequent in some parts of the world and an awful lot less frequent in other parts. The commonest reason for this is really about hydration. If you think back 10, 20, 30, 40 years in Australia, the vast majority of Aboriginal children had huge amount of kidney stones, and this was because there was a huge amount of dehydration within that population. Nowadays, it is relatively infrequent because of the amount of water that's available for them. Within the Western world, relatively few patients have kidney stones, and within my own practice, where I look after kidney stones along with an adult colleague, and we drain maybe 4 million people, we would only really get maybe 2 to 3 kidney stones a month, and the vast majority of these do not require surgical intervention and disappear. So it is less frequent in the majority of parts of the world. Places where it's more frequent is now the Middle East, and also there's a very, very, very high incidence of stones within the north part of India, so stretching from Pakistan all the way across, and Afghanistan all the way across towards the Himalayas is a very, very, very large instance of stones, and it's called the stone belt. That population is relatively mobile, and more people are leaving Afghanistan and northern parts of Pakistan due to political reasons and migrating to other parts of the world. So other parts of the world are now seeing more stones because of movements within this population. But generally, worldwide, I would say that we're seeing less and less stones because better hydration is really occurring.
At what age do children usually form kidney stones if they do get them, and why?
Well, oddly enough, even little tiny babies can form kidney stones. So premature babies who are given, particularly those who are given TPN, which is being fed through a drip, they can form little kidney stones which can resolve and disappear entirely themselves. So the majority of children who form kidney stones usually have a structural problem within the renal tract if they're very young. So they may have a dilatation or an obstruction that has not yet been resolved or been picked up on ultrasound scan. So that's in the young group. Other than that, we tend to see kidney stones in children who are, typically 7, 8, 9, 10. It's not unusual for them to occur in that period of time. And then we can see them again, a slightly older adolescent group heading towards adulthood. And it's not at all unusual for these little peaks along the way. But they are relatively infrequent within the general scheme of things of normal children. Very rarely would children have a kidney stone.
What is the most common type of stone that children would get?
Well, the most common type of stone is called calcium oxalate stone, which is a nice way of saying it's just a lump of calcium that's stuck together with a bit of oxalate crystals. In reality, it is an idiopathic stone, which means it just happens. It's one of those rare things. There's no structural reason for it. There's no abnormality of the renal tract. They just get a stone. And the vast majority of children who just have a single stone, which can be removed without any difficulty or disappears by itself, which is less frequent, they don't tend to reoccur. But a small number of children who do have stones, and they are successfully removed, even though there's nothing else going on with them, they can recur. Unfortunately, around 10 to 15% of all people who have stones can have a metabolic, so there is a particular reason, and they have a risk factor for producing stones, which will not be resolved is built into their DNA, so they have an ongoing, lifelong risk of kidney stone.
Thank you, Dr. Murphy. Thank you so much for talking to me today.
Not at all.